7 o'clock Thursday evening. It is August 25th, and I'd like to call together a special school committee meeting in conjunction with the Board of Health. Thanks everybody for being here this evening. We just have a consent agenda prepared and posted, and we also have our minutes from our January 2nd, as well as oaths to bills and payrolls. I'd like to accept a motion for those, please.
I'll move to accept the June 2nd minutes and the oath to bills and payroll.
Thank you. Second, please.
I can second that.
Thank you very much. All those in favor, say aye.
Aye.
Aye. It's probably supposed to be a roll call vote.
Brad Austin, aye. Yeah.
Yeah. Thank you, Stacy.
Stacy, aye.
Perfect. Justin McCarthy votes aye as well. Post on our agenda, this is our first opportunity as school committee policy to allow for interested citizens as it relates to this meeting. We'll take a quick pause to see if we have any folks that would like to share anything with us this evening as it relates to the agenda.
We do not have any raised hands.
Perfect. And at this point in time, I'd like to invite the Board of Health to call their meeting to order.
All right, it's 7 o'clock, August 25th. This is the joint meeting between the Board of Health and the school committee. 7 o'clock. We have a discussion regarding the public health crisis response guide the Board of Health has been working on. We wanted to present the draft to the school committee and allow for some feedback and input from the school committee members, as well as Dr. Clancy, Lynn Snow, and any stakeholders. Matt Wason, might you please share your screen and kick off with the first slide.
Good evening, all. So just we're going to go over two kind of tools that we've been developing as a Board of Health. The first is, for lack of a better name, kind of our guidance for addressing public health crises. We're trying to learn from the COVID experiences and realize that it's not just about some sort of acute emergency preparedness. It's more about how can we navigate through something larger like a pandemic and learn from that and kind of put something down in a document that we can then hopefully lean on in the future, or even better, never have to look at again because we'll never need it. But for lack of that, this is a stab at this. This is a working document. We've just started and presented to the select board once and reviewed it as a Board of Health once. So I wanted to get it in front of you guys just to also see what we're trying to develop, see where we can connect, see what thoughts you might have, things that we could add to help you out, or potentially make it an idea for if there's some application that you would also want to use it for. So I'll try to whiz through here pretty quickly so we can get to a more discussion. First, not a protocol. This is not a standard operating procedure. This is not a cookbook. This is an idea right now that's about guidance. So what can we look at to say, oh, when something happens and potentially we have a different board of members at the time, what can they look at and say, oh, here are some key things that we should work on? As I mentioned, foundation is based upon our learnings from COVID-19, but idea would be let's develop something that we could use in multiple crises. And there's a question on kind of, you'll see it in a second here, about level of community impact. So we also have to figure out how bad a crisis is. That's not necessarily a ruler that we have in every situation. So that needs to be developed when a crisis comes up. So it's kind of broken out into 5 pieces. Basically 0 being there's no crisis, and then 1 through 5 there are various levels of crisis or concern. At a baseline level, things are normal. Our respective boards or whatnot are meeting normally. We talk about things. We do have some actions in terms of just preparedness for the future. So whether it's managing stockpiles of supplies or just making sure we review plans and remember what they're all about, we should kind of just be thinking about the crisis that could come up onto our radar someday. Step into level 1, and now something is on the radar. Perhaps it's not here, perhaps it's not in Massachusetts, perhaps it's not even in the United States, but something is out there that we're starting to get concerned about. And here's where we'd say, okay, it's got our antennas up. We're going to start looking at it. The board doesn't really change how we're doing things, except we start actually making sure we have a standing agenda item to review this particular concern, whether it's data from public health or whatnot. We can start taking action and posting information to the website just so people have ideally one place to go for our town that can then direct them to the necessary information wherever it may be coming from. Moving beyond that to level 2, now there's definitely something in our community. So now it's impacting us here in Littleton, and we might still be meeting on a normal frequency, but now we probably have more information to be pushing out. So here's where I just added, say, it's about public advisories. So we're not just sharing data and saying, hey, folks, something's out there. Now we're probably making recommendations to the community as a whole or individual components to say, here's what we would recommend. Our communications expands. We're not just going to lean on a website. I think this is where we have to start switching from kind of a passive communication, which like a website, social media, that really expects people to come to us. Now we have to start figuring out, okay, not a lot, but what can we start pushing out for communication? So perhaps it's a town-wide email in this case. Everybody, I'm sure, is now fully informed about the 25-mile-an-hour town speed limit as of today, correct? Correct. Because we got the email. So it's not just posted somewhere. We all know about it because of that active communication. Next, I call it moderate impact. It's getting bigger. Now we're more concerned. Now, potentially, the Board of Health is actually meeting more frequently. Perhaps we're having a dedicated meeting just to talk about this crisis on an off cadence from our normal standing meetings. Still reviewing all the data, but now we're probably looking at, instead of advisories, we're talking about orders. Something's happening, and the Board of Health has decided that for the community, we have to put some order in place, whether it's a restriction on municipal buildings, public spaces, whatnot. Again, communication expands further here, scenario dependent, but perhaps now we're doing everything plus maybe using reverse 911, code red, other active communication methods. And then lastly, the major impact, something's really bad. We have emergency meetings called. We're meeting with the select board on a more regular basis. Communications going out, probably more restrictions, whatever that might be. So, as I said, the point is just to try to give us a framework to work in so that we can kind of, as a board and as a group of people and as a community, say, okay, well, we kind of fit in this bucket right now. So these are the things that we actually expect. And that's part of my driver for doing this is I want the community to be able to see the Board of Health responding the way they actually expected based upon kind of the plans that we've created. We've learned a lot through COVID, and I think part of it is how can we be very responsive, very transparent, and a little more immediate with our communication and understanding. So wrapping that up, it's, again, how do we figure out what crisis level we are? That's not defined. That's going to have to depend on the actual crisis that's occurring and the data that we have available to us. As some of you may know, we are creating a health department at some point over the next year. And our first employee is going to be a health agent, as it is called. We're looking to hire that person soon. They're going to have to be connected in with a plan like this. I'm not wild about a plan with no responsibilities attached. So that would be the first person to say, if there's something more concrete, or perhaps as a next level in of a plan like this, that health agent would be creating more precise plans or potentially even procedures to follow if we needed to in a crisis. And then lastly, I just want to call out that I think another thing we learned through COVID is that data is very helpful and data is not always available. We have to be ready to be in a situation where we won't have enough data to make a decision. It's just going to happen, or the data is going to be poor, incomplete, or we have concerns about it. So that's a fact of life. We're never going to have all of the information we want to make a perfect decision. So how can we continue to kind of document plans to at least guide us through some decision-making process? So that's our, as I said, public health response guide in a nutshell. We're going to keep trying to develop this and maybe add some other layers to it. But this is our initial launch of it, and we'd like to hear what you have to say, or thoughts or suggestions, comments.
Yeah, so Justin, if you wanted to query everyone on your side of things and put together some suggestions, comments, feedback, we're greatly anticipating. So
absolutely. We could probably offer you some now and then check in with the other folks that weren't able to attend the meeting. But Brad or Stacy, Brad, you want to go first?
Yeah, sure. First of all, I really appreciate the Board of Health taking the leadership on this. It makes sense that y'all would be the ones who are doing the the thinking about how we can do this better and what we can learn from what we've done before. I had a couple questions, Matt, that you already addressed. One is, how would this fit in with my understanding of kind of reorg on the health side of town government? And you've addressed that some. We're hiring a health agent. The Board of Health will work closely with that person. I was trying to figure out how that would work with this, and I think I understand that. So I guess my other question then, I have a couple of questions, but one would be about kind of what role do you want us to have in this? I really appreciate you asking for this joint meeting, us giving a chance to think about it. Our two bodies have been on the front line of this for the last couple of years. I guess what I saw in here where you were reaching out, there are certain, I think it was level 3 and level 4, where you're meeting frequently with the board of the select board, and I didn't see anything about school committee. And so I wonder if, as I'm trying to understand both the pure health side of this and the town government side of this, where you see the school committee having an advisory role, a participatory role, or just listen to us role. Is that something you can address?
Yeah, great questions, Brad. Thank you. First, briefly on the health agent, slight sidestep. Health agent is going to be the first employee of our health department. The public health
coordinator.
Public health coordinator. There you go. Sorry. They'll be reporting on a day-to-day basis to most likely town administrator with regular oversight from the board, but we just don't want them to we don't want to manage the employee regularly because of our meetings cadence. So very strongly connected, and we're just going to kind of be the people who help build that department and set the priorities and help that grow over time. So not a totally clear picture, I understand, but definitely somebody who has to be involved in this sort of situation.
Well, that's really helpful. I was thinking, like, who's the direct report? So that person will be reporting to the town administrator and working closely. I'm just trying to imagine an org chart. We'll be working closely with the Board of Health, but we'll have day-to-day oversight from someone else. Right.
We as a board will set the priorities of what they're working on, but we're not going to order the staples.
Okay, great. Gotcha.
So then your other piece, you're right. The school board is not called out here specifically. We launched this first as a joint meeting with the select board to kind of converse about it. So that's what it's growing out. As we've continued to talk about it, we also want to say, well, how will it connect to the town's emergency preparedness plan? How will we connect to these other groups? Does it actually grow into something that is a town plan, or does each board kind of maintain their own system? I don't have an answer for that. I think my vision would be if we develop our kind of plan and you develop a similar way of tackling or planning for crises, then let's see how they connect and plug in. I think that if we are in a situation like this slide, a level 3 moderate impact, I think we probably should be meeting with the school board on some cadence. Or is there something where the school board needs to call an emergency meeting with the Board of Health? I don't know. I don't know the answer to that. I don't know which direction is best. I just want to be able to say, and this is how we start with the select board. I just want to make sure we're on the same page and we have reasonable expectations of what the other group might be doing, just so our conversations when the things get hairy are smoother. Is that fair?
That's helpful. Thank you, Matt.
Yeah, Brad, I see the role of the school committee as advisory and participatory. As we've seen throughout this whole, COVID scenario, the school committee and the schools, and Dr. Clenchey and Lynn Snow, you guys are on the front lines. So there's information that comes to light on your end of things that, could be very helpful in, the Board of Health determining, sort of where we are and where we're going and what decisions and steps need to be taken at the current moment. So it'd be great if we could, as a crisis arises or gets worse or evolves, if we could certainly stay in communication and pick your brains, get your advice and your participation on all fronts.
Well, and I don't want to step on all Stacy's questions, but that did relate to one of my other questions when you mentioned, I think, Matt, about the inadequacy of data we sometimes have. And I think one of the things that we learned over the last 2 years is the school committee, school systems actually generate some of the most real-time, or can, in certain circumstances, generate real-time data that was pretty helpful for us thinking through it at the school level, but certainly I think it helped y'all in the town too, seeing cases and stuff. And so I guess my bigger question about this was, if we know there will be challenges in having the data that we want, can we take proactive steps to collect certain types of data, or direct, can we not just be passive in this sense, as we can identify gaps, or can we use this as a way to go out and generate the data, or find ways to get it? Does that make sense?
I like your thinking. And the next thing I present is kind of our data tool. So I'll hold an answer to that until we get to that. And then, yes, exact conversation we should be having as well.
So and something to go back to your second question, and as well as the data gathering, one of the things that we also need to kind of do is look at it and say, this is the single source of information. We can't have this source over here and this source over here and this source over there. There needs to be a single consistent message from the town. And if it's health related stuff, then we absolutely need to start, publishing that from the Board of Health's page and things like that. So while it's there, we need to figure out how to make sure that that message is communicated appropriately.
I agree with that in certainly in principle. That's exactly the way we hope it would work. I think we've experienced, and we can anticipate it would happen again in the future. There may be times when different elected bodies from this town disagree about what the appropriate steps are. We'll have to find ways. I think we muddled through and ended up landing in the right spot most of the times over the last couple of years. But I think it would have been really helpful to us and to y'all probably to have greater clarity, consistently explain to people about who's making decisions about what. And I think this is really helpful for y'all. We'll have to think about, as a school committee, degrees to which we'll just, whether we want to adopt something like this, or, I guess I'm still thinking about what action the school committee can take relative to this, other than learning about it and giving feedback and giving you an attaboy. There's not a question there. I'm just processing this. I'm sorry.
All set, Brad? Stacy, would be entirely appropriate if you don't have anything to say, because Brad covered a lot there. But if you have some feedback or some questions, now would be the time.
There we go. As I said, it's always great to have Brad go first, because he usually covers a lot of the questions I have too. So when it comes to the data, I'll just kind of wait till you guys get to that second part of the presentation, but I'll echo Brad that I think this is a really great idea to just kind of learn from the past, so that in the future we can have a more expedited and just a smoother response for the community. So just a few, like I said, Brad already kind of covered a few questions I had. So I actually just had a few recommendations for you guys to think about, just if this is going to be kind of the template for us going forward, and potential boards going forward that maybe haven't had the experience that you guys have had here. It was just defining a few things to clarify for the future. And one of those was kind of defining what a current public health crisis is, as defined by who. Is it a pandemic, or is it an endemic, or just kind of being a little bit more specific, so that we all have some kind of guidelines as to what that actual crisis is, like when to kind of sound the alarm bells. That was just something when I was reading through it, I was like, what, I would want a little bit more specific information on that. And then also, figuring out how the school committee gets integrated in this, and when, and how you want us to be involved with it. Obviously it's a work in progress, so we can work with you guys on that as you kind of fine tune this. And then I think just the last thing that I had was just the where you can add kind of how you're monitoring this. So in each of your sections, you have kind of like the actions. I feel like somewhere in there, and as you guys are probably working on this, monitoring and collecting data is something that would be, I think, important to just insert into those action levels, so that everybody knows when it's actually time that we're we're monitoring the progression of any type of public health crisis. So that was just my feedback. I think this is a really good foundation. So I appreciate you guys working on this and kind of incorporating us on that. So yeah, that's about it for me.
Brad, follow up?
I made those notes.
So just one more follow up, and Stacey's comments made me think of it. As I'm going through like the different stages, would it safe to say like monkeypox now we'd be in level 1 where we're paying attention to it, but we're not having special meetings? Is that, I'm just trying to, if we're trying to define what a public health crisis is.
Yeah, that's kind of what I was thinking too. I was like, if monkeypox is our example, where do we fall in this? But there's not any specific guidelines right now as it stands for us to know where we would be. So with that,
I didn't want to put you on the spot, but that is something that you're thinking about, and we've thought about some too. Is this kind of, and I know it's not a defined protocol or process, but if you're trying to like kind of figure out where y'all are in this with the monkeypox questions, would it make sense is level 1 kind of where you are?
Yeah, great question. A good call out on that. I'm an engineer, yet I've intentionally left things very vague and very soft, and it's hard because I agree. I would love to have these perfect boxes. We'd say we all agree we're all right here, because if you don't have that, then it becomes a discussion and concerningly a debate about, well, I think we're level 1. Well, I think we're level 3. We're going to have to keep chewing on that. I agree. I would put monkeypox in level 1. We're not ignoring it. It's not a nothing. It is impacting Massachusetts. I would say it's having a minimal current impact on our community, but it absolutely exists. And we have started reviewing data at our regular meetings, and we do have information posted about it. So we are already kind of like just working with this to see how it feels, but that's exactly it. Again, if we had a discussion, somebody might say, well, I think it is a minor impact. And maybe as we work through stuff, this unfortunately develops best when you actually apply it to a real world scenario. Because if you're trying to create it in a room, in a conference room, you're not going to come up with all the possible permutations. But that's why I love, a living document that we can actually push on and squeeze and test and see how it accommodates our needs. But great feedback and good thinking. Thank you.
And I just had one more question too, or not a question, but just some feedback. Do you guys have any specific resources that you tend to lean on when it comes to recommendations or data, like CDC or the WHO? Like, is that something that should be incorporated as well?
Good thought. We can. You kind of mentioned the data. I left it out simply because to me, it's all, well, of course we're going to be getting all the data, but yeah, let's call it out. Let's put it in there. And similarly, yes, it's going to be the WHO. It's going to be the CDC. At the same time, it's going to be whatever crisis that might be. I haven't thought about all the possible crises, so perhaps it makes sense to start building a list of potential resources, potential sources of data, just so we have them. But it'll be the common players. We know of all the ones we're going to utilize through the COVID experience. We'll have to think outside the box to say, well, what other crisis might come up that will fall into our lap that we might need to find new sources. But thank you. I'll make note of that too.
So one of the other things about that, data science and things like that, being a computer scientist myself and working with lots of data all the time, non-novel sources of data is also something that the COVID crisis also kind of showcased as some of the things where, like, Johns Hopkins and a few other universities, University of Washington and a couple others internationally, started actually providing COVID data earlier than a lot of the other traditional sources, and turned out to be a relatively good early indicator of what was going on. So, boxing yourselves into specific areas of data sources and listing them out is not necessarily something we want to do in this document, in my opinion. And it should be, for example, an EG or something like that, not necessarily a strict list of only these items.
I would say that makes perfect sense. Justin, or can I ask one more question? If you can look at, if I may see the level 3, I think we're talking, I think Kevin just mentioned the wording. This may be intentional. It but as I read the actions, it appears that any orders will come jointly from Board of Health and Select Board. And that wasn't necessarily the way things happened over the last couple of years. Promptly attends a joint meeting with Select Board to discuss and impose order. I don't know if that is the intent that your board and Select Board would jointly issue all orders, then that's clear. If you want to reserve the right for the Board of Health to do something independent of the Select Board, this isn't a binding document probably, but it's be public. Some people could read it that way and say you can't do that.
Valid point. We should tighten up the language there. Ideally, we meet with the Select Board and we're all on the same page, and the Board of Health still imposes the order as to whether the Select Board does or not. It is within our responsibility to do so if the need arises. So it was, without putting it in writing there, it's ideally we all agree that this is a great plan, but you're right. If there is some disagreement between the Board of Health and the Select Board, the Board of Health may still be in a position to impose an order as needed.
Well, that was my thinking. I was looking at the relationship between those two boards, but of course, as a school committee member, I'm thinking about the relationship between our boards as well. And if the Board of Health has the authority and the responsibility for being the one who issues those, you probably will want to clear that up because, look, we've all had some disagreements about who has the rights, the authority to make certain decisions. And anytime we can be clear about who has that right and authority, I think it's better for the community.
Perfect. I'll just offer my feedback. I'm not sure if it's feedback or questions or more so me just thinking out loud, but certainly want to thank you folks for doing the work and putting a document together like this. I think it's extremely helpful. And one of the things I was thinking about was, geez, why would you need something like this? Because if it's a public health emergency, we're likely going to be receiving advice from the state or national health agencies. But if I reflect on how sort of COVID went down, we were all left to make our own individual decisions, which was cumbersome and time consuming and odd at times. So I think it's helpful that you have something like this. And I would, the elephant in the room, of course, is that, when the state, or in our case, when DESE, ultimately finally gave us some control or sort of laid out a roadmap for us as it relates to masking. If you do X, Y, and Z, this is what you can do for masking. There was a difference. Your board at the time had a different frame of thought. So I just think you guys probably want to consider that or think about that going forward, that, if it's a situation that's unique to Littleton, then it would make sense for you folks to possibly have a difference of opinion. But as it relates to a public health emergency at a statewide or, Middlesex County wide or whatever, you probably just want to be pretty careful in having extra restrictions that aren't necessarily in place across the state or things like that, because we all know. So, but thank you for putting this together. And I think it's helpful.
No, thank you for pointing that out, Justin. It's that we got lots of advice, but it was often kind of vague. And that's absolutely one of the reasons that I wanted to build this out, is because I felt there were times when we were getting a lot of advice or instruction that wasn't even necessarily clear. But then there were a lot of times where it was, a best message. And that's the really hard one, because if nobody wants to kind of take responsibility, that means nobody has responsibility, and it stinks. And I feel part of it has to be because nobody wanted to be the bad guy. And I think we were let down as a community by those larger organizations that I expected a little bit better support for. So at the very least, I want to try to say, well, this community, we're going to do better. We're going to be smart about these things, and we're going to ideally be, as kind of we've heard already, a little more proactive and paying attention to things so that we have a better plan in place early on. But I agree. It's how can we have something a little more better guidance, and we're all on the same page, at least at the start of the book.
Perfect. Thank you. I don't want to leave Dr. Clenchy and Ms. Snow out. So if either one of you has any feedback or questions, now would be the time.
Thanks, Justin. First of all, thank you for taking the time to create a guidance document. I think it's a move in the right direction. The only question I have is if we have a crisis that rises to level 3 or 4, I don't see anywhere in the document, unless I'm missing it, the outreach to other health boards and the surrounding communities. I just think that's something that one would, in my opinion, I think that would be advantageous to the cause.
Very good point, Dr. Clenchey. It's actually on our data tool is also a connection to the communities because that becomes a flag for us. You'll see in a second, but if all of our surrounding neighbors have put restrictions in place, for example, that's a red flag for us that we should be trying to follow suit. But you're right. That is also something that we have kind of working right now, or work to be done, is a better connection to our local other neighbor boards. Mm-hmm. But good point. Mm-hmm. It should be included in here.
Great job. Thank you.
Dr. Clenchey, there's also the Massachusetts Boards of Health also has an organization that we can tie into and get more information about all of these topics and what's going on in individual things as well.
Okay, well, that's helpful to know. Do you have a direct connection to DPH? Department of Public Health?
Yeah, yes. I'm pretty new on the board. So Kevin?
Yeah, Jim Gariffi right now, our current health agent, has a direct connection with DPH. Okay. One of the top line items on the job description for the incoming public health coordinators to work regionally with other health boards and surrounding areas and in our region, as well as closely with DPH and get a local contact that we can work closely with there, not only in regards to a health crisis, but many other things.
Well, thank you. I think that would be very helpful since we certainly get a lot of information from DPH sent to us. So I'm hoping you get the same information as well.
Great. Lynn, any questions?
No, I like that there's a plan that the Board of Health is going to have. It feels a little bit comforting.
Great. All right. Kevin, you want to move the agenda along?
Sure. Or did you want to see if there were any hands raised for public input?
Sure. Let me take a quick pause, see if we've got anyone in attendance that would like to ask any questions as it relates to the document that we just viewed.
We do not have anyone.
Okay.
Great. So then let us move on to our next subject, which is the ID decision support tool that Matt Wace has been referencing. And Matt, if you could pull that up.
Okay, one sec. Let me move this real quick so I can see things. Okay, thank you. First, thank you for your feedback on the last thing. That's very helpful. I love the conversation. So the next piece, this actually was the first piece that we developed as a board, similarly to try to improve transparency, improve an understanding of how we as a board are kind of making our decisions. This is titled the Infectious Agent Decision Support Tool. And again, for that one as well, bonus points on new acronyms that are witty and fun. But again, this tool is trying not to be a COVID tool, but trying to be something, again, that becomes a data dashboard that you could use for whatever the situation that might come up. In this case, it's obviously very COVID heavy. We've not created one for monkeypox. We're just kind of reviewing the data that's already posted on the Mass DPH site and the CDC sites. So we wanted ideally to have data that felt more impactful to community members. It's really easy and probably a natural human tendency to see data that's from somewhere where you don't think it's you, whether it's a different community, a different country, a different group of people. And it's kind of this underlying urge to say, well, that doesn't apply to me then. So we were really trying to come up with, well, how can we communicate a little more closely to our community to say, well, the impact is real right here in our backyards, as it were. So this starts off just saying, okay, here are the variants that are going on, and these links go out to where we're getting this data. But then the first block is about health and safety. Don't get caught up in the titles. We're just trying to bucket these a little bit. So first was ICU Bed Access. Now, this is reported in a lot of levels, but we were trying to say at least show us ICU beds that are most pertinent for our community members, as in the closest place you're going to be taken in an ambulance if you need an ICU bed. So this is not about our people with COVID getting sick enough to be in the ICU. This is about if ICU beds are being occupied with people with COVID, if I have any reason whatsoever, not COVID related, to be in an ICU bed or to need that bed, will I be able to get it? And so I see this as if an infectious disease is causing an impact at our hospitals at this level, then all of us need to be concerned about, even if we're not going to get COVID, we're all have to be concerned about because we might actually need that bed for some other reason. So that's why it's in there. And this is, as I said, reported weekly from the state. So we pull that data directly. Next, there's always been struggle with case rates and admissions and staffing and such, and how should we report it? We, at the end of the day, we decided to just go with the CDC community level, which is a single metric. It's just a green, yellow, red. It's about our county, at least, Middlesex, but it includes multiple components of how the disease itself is impacting our area. And this is what is referenced in the CDC's guidance on schools and daycare institutions and such. They point back to their own CDC community level as something to monitor. And then lastly, this is one we're still trying to develop better. It's about up-to-date vaccinations. Unfortunately, the state only tells us how many people have gotten a booster, but that doesn't give us a good denominator as to how many people should have a booster or how many people are actually up to date on their booster. So we're trying to work with DPH to get better data around this. Thus far, we've kind of done back of the napkin calculations to figure out, it's not just have I been boosted, it's actually, am I up to date on the CDC's recommendations for vaccinations? So with the school age kids, some of them are ready in the timeline for a booster. Have they been boosted? Are we looking at those? It's a little harder data to get. By popular demand on the right side, we did put up the Littleton 2-week case count numbers. This data is helpful in a thimble. The axis is almost pointless because so many cases are not tested by a PCR test in a provider's office. And that's where this data comes from. Home tests are totally ignored. And so we know these numbers are always way higher than they really say, but hopefully it at least shows us a trend. And that's what we're monitoring on that one. As we go down, here's our town section. This is really, really close to home stuff. As you know, we had the public school prevalence data there that was very valuable. It was mentioned earlier. Such an insight into our town's health because it's a set group of people that were being tested regularly. And that was one of the only really measures that we had that was prospective, looking at what could be coming into our community. So that was there. And then the other one is, we're still chewing on this, is something about town services and how is our town and the municipal services, how are they functioning? The school, in my mind, it would be included in this in terms of staffing. Are teachers able to come to school? Are the nurses able to work? Are the administrative staff? You know, if our municipal services are starting to struggle because of the impact of something, I think that's something that we need to be sharing with the community to say, it's serious, folks. We're having trouble actually keeping the offices open or keeping the doors open or keeping the people coming in. So as I said, that's still work in progress. I think in my mind, I ideally would like that to be perhaps owned by the town administrator, where all of the other groups are kind of feeding information up to that level. And there's a distinction, again, a red, yellow, green set at that level to say, here's how the town is doing as a whole. And then lastly is kind of called community. One of these is the wastewater data. We're still getting this out of Boston right now, that we're looking at some other wastewater sources, but this is another one of the really good measures we have that hopefully predicts a potential community impact. So if we see spikes in the wastewater, our data analysis thus far shows that our community here in Littleton will likely see an impact in 2 to 3 weeks after that. So we're using it as something to say, if we see that number turn red, that's something where we might jump, as we were talking earlier, Brad, that might push us up a level. Even though we're not seeing cases right here, this data we know enough now that we might start putting advisories out if that turns red. And then lastly, the neighboring towns, as I mentioned, Dr. Clenchey, what are our towns around us doing? I know in the past we might have been leading the way there, but if our neighbors are all doing something we're not, we should probably think strongly about why not. And then lastly, of course, if there's something coming down to the state level, obviously we can't ignore it. We're going to do that, but that also should kind of affect our thought processes here. So that is our data tool that we have that we've been kind of using right now and reviewing on every other week basis at our meetings. It's kind of been yellow. There were times when it had some reds and some greens, but it's been really consistent yellow right now, which I think for our board just makes us worried because we know school is coming. We know people are coming back from vacations. We're all going to be right back in our tight little community and not sure what's going to happen next. So open it up now, please.
Does anyone from the school committee have some input, feedback, questions, comments?
How about we don't let Brad go first this time, Stacy?
Ooh, I get to go first? Ooh, let's see. Yes, absolutely. Again, this all looks great. Looks like a great foundation and framework for what you guys are trying to accomplish. And, I can tell that you guys are kind of still piecing things together and formulating kind of a full plan for it. So again, just a few things, thinking out loud, and just a few things that came to mind for you guys to kind of stew on. One was the ICU bed access, during COVID, and it's always going to be different depending on what kind of crisis we're dealing with. But during COVID, obviously ICU bed access was a really important indicator for us to figure out where we were in that crisis. And I think I noticed, Matt, you said you were kind of going to be focusing on just kind of the local access to healthcare, just kind of for our own town. But one thing to consider too is just keeping an eye on local communities as well, because when they're overflowing, they're eventually coming into potentially our resources and our town where our community members would be seeking some type of healthcare. So I just thought that was something to just keep an eye out, just not to look at us, in a small vacuum, but to obviously keep an eye out in surrounding locations as an indicator for kind of how it's going to be or potentially could be affecting us. And then when it came to the public school prevalence, the question that I had for you guys was, where and how are we working together to get that data? Like, what is it that you guys are thinking the school is going to be doing to kind of give you that data when it comes to attendance and teachers being out and students being out? Do you guys have a thought on that yet, or?
In my mind, that's the meat of what we as two boards together now need to really try to work on. I'm not necessarily privy to the discussions you guys have had and what plans you might have in place. If it's something where you could say, "Oh yeah, here we go, Matt. This is what we're doing. So can we feed this to you and plug it in?" Great. If it's something where we need to try to converse to figure out a different solution, that's what we need to do. It's my understanding that the state is not going to support you doing testing for students anymore. And unless there's a plan for Littleton Public Schools to do their own testing program, which I don't believe there is, then we don't have that data anymore. It's a good question. And I made a note of that as a conversation topic that we should have. It's like, well, then if we don't have that regular large pool testing, then how will you and how will we know when a problem happens? And a lot of those guidance documents, this is part of the advice we're getting, right? A lot of those guidance documents refer to, well, if you have an outbreak at your school, then thou shall, but talk about definition. How do we know we have an outbreak at our school?
Right. Yeah, that's kind of where I like things. I'm type A too, so I like things defined. So those, I love the broad strokes you're incorporating to it right now, but I definitely would like more definition on some of these things so that it's just clear. Because what I hate to see is in the future, if this happens, that there's so much time debating the nuances of the plan that there's not enough time spent on actually coming up with something logical and actually implementing something that's safe for the community. So yeah, I understand the need to be general, but I also see the value in being specific for the future and just kind of letting, that board be able to take it for what it's worth at that time. So obviously it's a work in progress. So I see that you guys are working on it.
Well, but at least for this tool, that's why we do have numbers. We do have numbers here. And I would say that's what I would encourage your board to say is, you'll have to figure out what that definition is. I'm happy to help. You guys know what data you have access to, how the procedures are going to work. But together, if we can come up with, well, this is how we are going to define a problem, and it's not just a, on off, maybe it's a 3 level like this. Maybe you guys need 2 or 4, but it's what are those thresholds going to be that are going to put you in a position where you say, we thought that we drew a line here and that we're supposed to do something at this point. Are we supposed to or not? That's kind of how we've built this decision support tool. It's not, if things turn red, we don't have a definition that says, well, when 3 of them are red, then thou shalt. Because again, it's relatively new. We haven't tested enough, but it should at least bring us together as a board and look at each other and go, oh dear, 3 of them are red. Are we going to pretend we don't do anything? Or is now the time that we do take one of the actions we've talked about? So that's what I would kind of pitch back to you guys, say like, hey, how, what is that going to look like? Do you guys have ideas or thoughts about that? Or something that's already in progress that I'm not aware of? Like I said, I'm not plugged in well enough to the school committee. So I admit my kid doesn't go to Littleton Public School. So I know what my school's doing, which is completely different than this. So, but yes, what do those lines look like? And how do you know when you as a group look at each other and go, we're supposed to be doing something now?
Yeah. And I think one of the major things that's I'm thinking about too is anything that kind of falls into our laps now or in the future. I foresee it being similar to COVID. A lot of the criteria you have are like vaccination rates and access to testing and stuff. The first year we didn't even have access to that. We couldn't even test to see if people had it. It was mostly based off of symptoms and then just a guess or an assumption that if you're having those symptoms, then we're just going to assume that you're positive because we're trying to reduce transmission rates. So, it's probably important for all of us to think if we are faced with that crisis again, where there's so many unknowns, a lot of this we won't be able to implement as effectively because there will just be so many unknowns. So, it's just helpful to maybe think of what we would do in those circumstances so that we can be clear with each other and clear with the community as to how we can approach so many of those variables that are unknown.
So, go ahead, Lynn. You actually have your hand raised.
Sorry, Lynn had her hand up for a quick second, and there were some questions related to data and the planning and the testing and all that stuff, and I wasn't sure if Lynn was looking to jump in to provide.
Nope, I was actually just trying to make the spreadsheet bigger, and I was trying to scroll down and realized that I couldn't because it's a presentation.
Okay, your hand showed up as a raised hand for momentarily. So
yep, it did. Are you able? Can you scroll down so I can see the second half of that? Okay,
sure.
Okay, that's all I wanted to see. Thank you.
Yeah.
So one of the questions I had actually for Lynn was, I've taken a look at what DESE's come out with. I looked at what DPH and CDC have come out with. And you guys are still going to be, looking at it from a, like if someone is symptomatic, you're going to be giving them, quote, a test at the school. And maybe, I know you're going to be keeping track maybe of the number of tests that you've given and the number of tests that have turned out positive. Is there a way that we can capture some of that data? Is there also a way that your absenteeism rate is going up and maybe the nurses know that a student's absent for COVID or not COVID? So that way we, at least out of the students that are absent, we know that this percentage is for, some sort of either flu, COVID, RSV, whatever communicable disease is out there. Is there some way that you guys could break that down, or is that a big burden?
Well, so there's no reporting requirement to DESE for case counts.
Right.
So that's discontinued. For our health office visits, we do have a lot of detail in our health office visits data that we collect. So that is data that we just collect. And we have our attendance data always.
Right. I'm not asking for the reporting information. I'm asking for what information you may have that you can share with the Board of Health to kind of look to feed into some of these numbers. I know there's not a mandate to do the reporting, but we're looking for the collegiate exercise to work through it and try to gain access to some of the data.
Oh, sure. I mean, I would defer to Dr. Clenchey and the school committee on that. We always have the capacity to collect any data that we need to.
Yeah, thanks, Lynn. I can certainly address that. At this point in time, we will internally collect data when it's provided to us. We'll encourage families to provide that data to us. We are not administering antigen tests. If students or staff are symptomatic, we will send tests home with them as long as our supplies last. And as all of you, I'm sure, are aware, health plans provide a number of tests for free of charge for families every month. So as long as that continues, that would be our course of action at this point in time. We always collect internal data. I guess that the key here is at what point does it trigger sharing some of that data? I mean, we are connected with DESE and DPH, and we have a hotline we can access if we have questions about what's happening in our schools. So it is imperative that we do what we can to keep data on COVID, but it's not going to be as accurate as it was last year because there is no reporting requirement. Would you like me to continue on in terms of what we're hearing from DPH? Actually, we had an update today. We had one last week, but a few changes. DPH DESE guidance at this point in time, there is no quarantine period. If an individual is exposed, they recommend that the individual wears a high quality mask for 10 days. And accesses a test 5 days after their last exposure. If you contract COVID, isolation for 5 days. If you're fever free for 24 hours without the use of medication and your symptoms are improving, the individual can return to school. Individuals with moderate illness or severe illness or a weakened immune system should isolate through day 10 and consult with their medical provider before ending isolation. The only other protocols that we have that anybody entering the nurse office has to be masked.
So if I could ask a question there, because I was reading this again, it's feels pretty advice-y and leaves us with kind of some questions of, well, how do we operationalize? So, for example, a child is a close contact, has an exposure. As you point out, they're not required to quarantine. They're allowed to come to school, but they are, what's the word I should put here? They are required to wear a mask. They're supposed to wear a mask. They're encouraged to wear a mask, or something else.
Encouraged.
Okay. Because that's should do so is the language that you're stuck having to handle, right?
Exactly.
And I know the logistics become, A, how do you even know that this kid was an exposure because nobody's reporting it? B, how do all of your staff members possibly keep track of a child who's supposed to be wearing a mask for Tuesday through next Wednesday? I know it becomes a nightmare to try to manage that. So, but these are the kind of things that I want to kind of think about, that so that as we develop plans or as you look at the data, you say, well, how can I best prepare myself to monitor this? Like you say, if parents don't tell you that their child is home for COVID reasons, you don't have that data. So is the best data you possibly have just general attendance? And if it just so happens that the flu hits and attendance, gets poor, we just have to converse and say, oh, well, it's actually because of the flu, most likely. That's our best bet. I'm not sure.
I think our strongest data point, as you pointed out, is our attendance. But we're hoping our families have been great, and when they phone in, they freely give us information, and that will certainly help with our data collection. But it is difficult. I mean, as COVID has continued, there have been many things that have happened. We have vaccinations readily available. We have treatments, et cetera. And the strains, the variations or strains definitely act differently in terms of severity for certain age groups, et cetera. So from what I can tell, at this point in time, they're treating it more like a pandemic and similar to a flu, with the exception of the 5-day isolation requirements if you have COVID.
Can I chime in?
Yeah, Brad, let's hear you. Absolutely.
Yeah. So, going back to Matt and Kevin's question about kind of two different town boards sharing information, my hope as a school committee member is that we are doing our best to track number of COVID cases. And maybe that's just by families reporting or kids that miss 5 days in a row. We can get a number that's helpful, if not perfectly accurate. And that we share that information with the school committee as needed and with the Board of Health. I just think, if these are things that, Lynn says we'll be keeping track of anyway, then whether it's an email or a quick phone call once a week or so, that seems like the right thing for two town bodies to do. If it's not creating a whole new reporting apparatus for us, and it's information the Board of Health and the school committee will want to monitor, we'll use it with all the caveats that we all understand will have to be applied. I do think it would be helpful information for us.
I do want to say our families have been wonderful over these past years with partnering and communicating with our nurses. And I mean, I've no reason to believe that level of communication would discontinue. So I do think our nurses have a lot of valuable information that they're getting through communicating with families when kids are ill for any reason. Parents are always sharing kind of the root cause or following up after a visit with the pediatrician.
Well, and so Lynn, if I can jump right in. So then if your nurses are reporting, hey, look, we had 6 cases of COVID, we had 12 flu cases. That's also information the Board of Health might just want to have. And once again, we found out over the last year and a half, the schools can generate a lot of valuable data. If we can do that within our regular kind of reporting mechanisms and can share it pretty easily, I would hope that we would do that.
Yes, and as I said, our Aspen, the portal that we use for health office visits does have nice detail in it.
Awesome. Thank you, Lynn, and thank you, Brad. That's I would say if you feel comfortable at least with kind of an attendance rate data, I would go swap out our public school prevalence that we previously used, and I could put attendance in there if that's something you'd be willing to share regularly. I forgot to mention earlier, this spreadsheet right here, the ID tool, we are just hopefully very close to actually having this posted on our town website so that it becomes something that's more live and accessible to the public. So it could be something where just if you decide on a reporting cadence weekly or every other week or something like that, we could figure out a way to just make sure we're getting ours updated off of that number. And then I would just say, you tell me kind of what those 3 numbers might be that dictate green, yellow, red that you want to use internally as a decision point to say something, because then we can put that in here. And so we can say, if this has gotten to a red level and the school's worried about it, then we should also be worried about it as a community. These are the steps we will take.
And I just want to be clear to everybody, we're fine with sharing data with you. I hope nobody thought that we weren't. I'm not convinced attendance data is going to tell you the story that you need to. I mean, we have so many reasons why students are absent. We can certainly keep tabs on that, but we can start off by tracking the COVID data that we receive, and we'll keep an eye on our attendance. And if things are apparent that students are away due to illness and it's increasing, we can certainly provide you with that information.
Can I just ask did we do any of this sharing of data like before COVID when the flu was going around, or if any other viruses were going around the community? Is this something that we monitored as closely?
No, we didn't.
So I'll just jump in. Along those same lines, I'm really optimistic that as a school committee, we're going to do normal school committee business this year and talk about school improvement plans and student achievement and all that good stuff. And I will pledge that, in the event that the data gets to a point where we as a school committee start talking about public health again or COVID, at that point in time, I think it would be appropriate to share that data or bring you folks in. I mean, I've had open lines of communication with Kevin Baker for 2 years now. So I'm really hoping that it's not a topic that we're focusing on over the course of the year. And I'll say that if and when it does become a topic, that we will be sharing that information with you. I think that's probably the best that we can do.
So my feeling on this, and I think Matt might agree with me, is that we're trying to be a little more proactive with our data and having it on a more regular cadence to help us be more proactive as a community and to look at the data tool is where we kind of want to land with this a little bit. I understand, schools didn't track other data and, kind of what's going on, but it's that kind of is the job of the Board of Health, is to kind of keep our pulse on what is going on. Just like yesterday, we talked about, hey, look, make sure you go get your polio titer done if you're an adult to see if you're traveling into the New York City and New York State area. That was mentioned yesterday. So we're actively trying to look at this and be more proactive than passive on this. And that's something that I think we also learned from the pandemic, was making sure we had access to that data. So that's kind of where we're looking at, establishing those lines of communication and, being able to ask those questions.
Okay, we can take that under advisement. I mean, we ran the COVID dashboard last year. I don't think we're running a COVID dashboard this year, but certainly we can discuss this more. We could give you a sample of what data we think we might be able to provide on a weekly or every other week basis as it relates to attendance or something like that. We'll have to ask Lynn and Kelly to try to come up with something and kick it around and share it.
Thanks, Justin. We appreciate it.
If that's what you're asking for.
I think that's what I'm fundamentally asking for. I mean, we're presenting data, we're presenting plans. I don't necessarily care what yours looks like. If you want to make something similar, make something different. I'm more at the kind of what Kevin was saying. How can we just make sure that if you see a problem or we see a problem, ideally we're both seeing the problem at the same time. So that it's not one group going, we have an emergency, and the other group going, I don't know what you're talking about. I think that's what I want to avoid. So if you want to figure out different data that you want to have, I would strongly encourage you to. I know COVID things seem okay right now, but please build a dashboard at the start of the right now to launch your year with. And man, cross my fingers that you find 3 months in, it's useless because there's no problem. But I would encourage you to do it, get it ready beforehand so that you're populating it early. And if it's green all the time, then you can decide to put it to bed, as opposed to trying to figure out when you should launch something like that. And I think for our kind of tool, I don't want to have a ton of data either. Just like last year, you guys had the school dashboard. We pulled out that one item, put it on this one. But I made a note of also, I'm not sure if I know you're not, vaccinations are not mandated for students. I understand that. But do you have that data on, like I said, the up-to-dateness of the vaccinations? Do you have reports on who's been boosted and have they been boosted within the 6-month recommended window? That sort of data. So I think you guys have some other data points that you have access to that you could also monitor. I'm not necessarily wanting to see every single data point you have. I'm just asking that you are looking at it so that you as a board have drawn some lines and said, well, we know when this gets to this point, it's going to be bad. And it's not going to be a surprise to the Board of Health or the community if that's the case.
Kelly or Lynn, correct me if I'm wrong, but I don't think going into this school year, we're going to be asking for vaccination data. I don't think anyone's asking us to do that. I don't think there'd be any obligation from the families to respond. It would be like you guys asking, you asking all residents to submit their vaccination data. I don't, Kelly, correct me if I'm wrong, but I don't think we're doing that.
No, that's correct. We I mean, we haven't tied it to anything. I would assume, maybe incorrectly, that Mavis would be recording that data for communities.
It is.
That's where we took it from last year. So, I mean, you can still get that data off Mavis, which might be helpful. And then, sometime tonight, if it's on, we plan for discussion, we should really talk about vaccination clinics, because that's one of the key ways to fight COVID. And, what are we going to do for that? I can tell you now that I've we've organized more correctly another 3 clinics. And we did that because we were talking to Vaccinate RX this week. But at some point in time, I'm hoping that can be taken over by a body in town that's more closely linked to the provision of medical services. But we do have 3 clinics, two in September and 1 in October, already scheduled.
Thank you, Dr. Clenchey. That's excellent work coordinating those vaccination clinics. We've been discussing that. We know there are some new vaccinations and new medications coming out. We are deliberating how best to go about that. And our public health nurse that we're going to be hiring as well, hopefully we'll be able to administrate some of those clinics as well.
And we would always be available to help out as well.
I have no faith, this is Gino, I have no faith that the superintendent will let anything like that go by. If something happened, he will find out immediately. Somebody gets sick, we'll find out whether they have a COVID, and they be sent home. Very simple. So you have to have a little faith on the superintendent and the school committee. They are there to protect the children, and they are there to make sure the Board of Health doesn't get excited. Very simple. And I have no doubt the superintendent is going to do his job as he always did, the best way he can. And I know him for more than you people know him, and I know the school committee more than you people do. So give them a leeway, and they will do the best they can to make sure that the children will not get sick. If they will be, they will be taken home, and then they find out whether they were vaccinated or not. In order to be safe, when you get vaccinated, when I got vaccinated, they gave me a little piece of paper, they call it little passport. So it shows when you got vaccinated. Some children don't like to be vaccinated, not because they don't understand what's going on, but their parents, they say, I don't want my kid to be vaccinated. But nevertheless, if they get sick, they're going to stay home until they get better. And then they will think about twice to say, you know something, son, daughter, you're going to have to be vaccinated if you want to go to school. Otherwise, you're going to stay home and put a mask on and be on a computer.
Thanks, Gino. I echo the words. The school committee feels strongly that Dr. Clenchey and Lynn Snow and the nursing staff of LPS and all those involved has done a terrific job with all of this. So, Kevin, you want to see if there's... I
believe Lynn wanted to speak.
Oh, sorry.
I just wanted to mention that we do collect the annual physical information from all of the families, and the nurses do enter it. And on that is vaccination, the required immunizations, as well as the pediatricians are now including the COVID vaccination data. So if we receive it, we will be entering it. So it might not capture everything, but we will have updated data on COVID vaccinations.
Great. Do we want to see if there's anyone that from the audience, public members, wish to ask a question or provide feedback on this document?
Please.
We do not have anyone. Justin.
Great. We can move right along then.
All right. Well, thanks for working with us on the attendance data. And as things progress, we'll figure out the best ways to move forward. And speaking of the vaccination clinics, like I mentioned, we are hiring a public health nurse who will help us to coordinate some of those. But in the meantime, Dr. Clenchey, please feel free to include us in any communication and planning that you're doing so we don't overlap or double up on things. In regards to take-home tests, we do have an allotment, and we're happy to get a whole package over to you. I believe they expired July 2023, if that helps to send them home with families. I'm not sure we can cover the entire population, but we'll get you as many as we can.
That would be very helpful, Kevin. We have 1,500 tests right now, two to a package. So any more we can get would be very helpful.
We can probably match that right off the bat, and then and work to get some more too.
Okay. Thank you. That's great.
And I wanted to actually, Dorothy, would you mind promoting Liz Tretiak from EHS? She just wanted to go over a couple things, and we can wrap it up.
Here she comes.
Hello, everyone.
Hi, Liz.
Hi. Great to see you all.
Thanks for coming.
Hello.
So we just wanted to go over some of the services that that EHS can provide to parents and families of students affected by COVID one way or another. And I'll leave the floor to you.
Thanks, Kevin. So like Kevin said, he just asked me to come on and discuss a little bit briefly about what our department can help the school with. Currently, as it is right now, we work really well, especially with Lynn Snow. She's been amazing when we have overlapping families who come to us for assistance. Part of what we do is, as the Department of Elder and Human Services, a majority of our work is with elders, but we've been seeing more and more families come to us for assistance. And a lot of times, if there is a child in the school system, we refer them back to the schools, especially for anything that's clinical. No one in my department does any clinical work. I kind of describe it as we're doing some of the boots on the ground work. So if a family comes to us in need for any reason, for something like fuel assistance or food stamps, SNAP applications, we walk them through the process, help them with the applications start to finish, and get them through those things. COVID, in a lot of ways, as you know, has affected mental health mainly, and we leave most of that clinical piece to your amazing school staff and your psychologists and your nurses. But the peripheral things that people need help with, like the financial burdens that come up with that, or housing concerns or lack of housing due to financial needs, we are happy to assist with that in any way. So if there are families or grandparents raising grandchildren, or really just anyone who is struggling in any way, we're happy to provide backup and assist as needed. I know you have your own mental health referral service that recently launched a few months ago, I believe. We have one as well that covers the entire town. I do know that sometimes it does have kind of a backup and a backlog and a waiting list, but that's the William James Interface Referral Service for mental health counseling, to connect yourself with a counselor. So again, I just wanted to repeat that Elder and Human Services is here to provide any sort of backup that the schools may need for assistance with families. We do quite a lot of home visits for various reasons, and we do offer assistance if people need their COVID kits delivered to their houses. We've been doing that as well.
Thanks, Liz. Is there a website or an application process to go through for families and parents for that?
Sure. You can call us 978-540-2470, or just on the town website. If you click the link for Elder and Human Services, you can get in contact with us. We have 2 outreach coordinators who are very experienced and can whip through a health insurance application in no time, or a SMOC application for housing assistance. So happy to assist and provide backup.
Thank you very much.
Thanks, Kevin.
Justin, do you want to just check one last time for public input and then any final comments from your board?
Absolutely. Thank you. It looks like we've made our way through the agenda. So we stopped a couple times for public input just in case, but this would be the second opportunity for interested citizens. If we have anybody that would like to speak.
We do not.
Great. We don't have anything left on the agenda. So, I mean, the school committee at this point will look to adjourn, but do you folks have anything else you wish to discuss? Or are you in agreement that we'll adjourn?
I just wanted to say thanks for taking the time away from your vacations and your families to join into this, I think, very constructive and, meaningful conversation. And we look forward to having more constructive conversations and work together to do the best we can for the town and the residents and everybody that we're responsible for. So thanks a lot, everybody.
You're most welcome. And we thank you folks as well. So thanks for working on the guidelines and the goals and reaching out to get this on the calendar. So we did it.
Before we wrap, what should be the next steps? Do you want help? Do we want another meeting? Do you guys want to work on stuff on your own? Are you going to inform us?
Why don't we just put together a recap email and sort of get all the stakeholders involved, and then sort of fine tune our documentation and our process, and maybe put together some workflow of, sort of who's responsible for what, when, and where. And then we can put that out there and then maybe reconvene after that.
Sounds like a plan to me.
Okay. So we'll talk about that at our next meeting on September 14th. Probably shoot some emails back and forth before then. But otherwise, everybody enjoy the Labor Day weekend. I'll make a motion to adjourn for the Board of Health.
I second, and thank you so much for the Board of Health, and also thank you so much for the school committee to be there and the superintendent. And I hope they understand that we mean well, that we only trying to help the town. Thank you.
Roll call vote, Kevin Davis.
Typing in a meeting is challenging. Kevin Davis votes yes.
Okay. Gino Fratelloni.
Gino Fratelloni says yes.
And Matt Wason.
Matt Wason, yes.
And Kevin Baker votes yes.
Yes, and I move for the school committee to adjourn as well.
I second that.
Perfect. Motion made and seconded. Roll call vote. Brad Austin.
Brad Austin votes yes.
Stacey Demaris.
Stacey Demaris, yes.
Justin McCarthy votes yes as well. You're officially adjourned. All right. Thanks, folks. Have a good night.
Thank you. Thanks, guys.
Dorothy, I have a question for you, Dorothy. Who's that good boy behind you?
That is my son's dog.